Unfortunately, I do have to share that today we had one more resident at Northwood who passed away due to COVID-19, and my condolences as well to that family. In total, we now have 28 Nova Scotians who have died from COVID-19, and each of those, we talk about them as numbers, but each of them are individuals who have families, and we have to remember that. My condolences to each and every one of those 28 individuals and families. We have 20 new cases of COVID-19 today, which brings our total number to 935. But as we talked about yesterday, over half of those can now of that total number of cases can be considered to have been recovered, which is really good news. 529, in fact. We continue to have 11 people in hospital, 3 of those in intensive care. And as of today, we've had 27,486 Nova Scotians who have been tested and have the good news of having a negative test. We have 10 licensed long-term care facilities and unlicensed seniors facilities who have had at least one case of COVID in a staff or a member or a resident. And we have a total of 227 residents and 97 staff affected in those facilities. Yesterday, the QE2 processed 905 tests, or testing numbers were up again yesterday. And to me, I take that as good news. We can't make firm judgments based on any one day, but the fact our testing volume was up again yesterday, and we have a relatively low number of positive cases, and the majority of those cases are associated with the Northwood outbreak, to me is a further indication that we are beginning to see a slowing down of COVID-19 in Nova Scotia, which is very good news. I also want to take a chance to recognize individuals at the lab. This week is Medical Lab Professionals Week, and I really want to acknowledge all the medical lab professionals at the QE2 Microbiology Lab for their extreme professionalism and dedication and very hard work that has allowed us to have the extensive lab capacity and testing capacity in Nova Scotia, and we lead the country in that. So happy Medical Lab Professionals Week to all my laboratory colleagues. And on that, I do want to encourage any Nova Scotians. We have lots of lab capacity. If you have concerns at all that you might have COVID, and the symptoms we're looking for are fever, new or worsening cough, sore throat, runny nose, or headache, if you have 2 or more of those, if you have online access, do the 811 online screening tool. If you don't, you can call 811 directly, and through either of those, you'll get more direction, further assessment, and direction to be tested if necessary. I would encourage everybody, don't wait. If you feel you have those symptoms, do the assessment. The sooner, if you do have COVID, the sooner we test you and recognize it, the less the ability that it can be spread around. So we need to not be afraid of not being able to get in for testing. We have lots of capacity, and as I said yesterday, we're looking at other ways to use that additional lab capacity to do testing in different ways to further track COVID-19 in Nova Scotia. I want to give a bit more of a detailed update on where we are at our long-term care facilities, building on what the Premier said. I'll start with Northwood. It certainly has been a considerable challenge for everyone involved, for the residents, their families, the staff, and the administration at Northwood. But this is a fairly unique situation, given it is by far the largest long-term care facility we have in Nova Scotia. It's the largest facility east of Montreal. So those sheer numbers present unique challenges in terms of the residents and the varying levels of care needs that they have at that facility. Also, with the large numbers of staff, mean we have staff coming to work in this facility from a number of communities throughout HRM and even beyond, and that increases, frankly, the opportunity for COVID activity in any one community to then be unfortunately brought in unknowingly brought into Northwood. So Northwood has had some unique challenges. And as the Premier said, the situation, while it remains serious, is become very much under control. It is certainly stabilized. We now have 10 residents who can be have been able to be deemed as recovered, who've been moved to the hotel, and my understanding is a significant number more in the coming few days. We'll be able to do that. While we unfortunately have had 22 people in that facility die, we have to recognize that we've had 211 residents who have tested positive. The vast majority of them, with good care, have been able to recover or are recovering, and their illness has been able to be managed. By continuing to move recovered residents out from Northwood into the temporary facility, that is giving increasing flexibility for Northwood, and they're a key priority of theirs, and they've been able to do this to the large extent already, is to make sure that as we do more testing, which is pretty well done, but as we do more testing, anybody who's positive, bring them into units where their close contacts on that unit are also people who have tested positive. As I said, we finished the initial sweep of testing. There will be ongoing sporadic testing of residents who are negative, because we know that over time they may turn positive, as well as continuing to periodically test staff. So that this is a challenging, difficult situation, but with the support of the rest of the health system, we've been able to stabilize this, and it's now on a good path forward. Still lots of hard work to be done, and it will take a number of weeks before we can say we're actually completely out of the woods and declare the outbreak officially over. But I do want to thank first all the Northwood staff, the administration, first and foremost, but also their colleagues from the rest of the health system, the Nova Scotia Health Authority, IWK, VON, EHS. We have other facilities have stepped up. The unions have been right at the table. We've had volunteers and from Dalhousie, medical students, home support providers, and even volunteers from the community. And I know from their restaurants and other groups the business community have stepped up in providing meals and other support. So I want to thank everybody who's from the health system and beyond who's come to the table and willing to work in a committed way and collaboratively to support Northwood. But we do have to recognize we have 9 other long-term care facilities or seniors' homes which have had at least a case of COVID-19. It's good. I reviewed all those this morning with colleagues. All of those facilities, we've had no new cases of COVID in staff or residents. So all the rest of our facilities who have had outbreaks, the outbreaks are stabilized. We don't have ongoing cases, and in many cases, before we can officially declare the outbreak over, we have to have a period of 2 incubation periods, which for COVID is 28 days. So these facilities, there's no ongoing disease activity, but we just haven't reached that 28-day period to be able to declare the outbreak over. And I think that's in the recognition of those facilities who, in a combination of good planning and foresight, as well as coordinated and collaborative responses from within the facility and with support from the rest of the health facility, we've been able to manage those outbreaks effectively, like we have been able to do in Northwood. So it's a testament to the preparedness and the commitment of our continuing care and long-term care sector, and I thank them for that. I'm going to end by emphasizing that as we talk about long-term care facilities, ultimately all Nova Scotians have a role to play in protecting those most vulnerable citizens in our long-term care facilities and other group settings like residential care facilities, homes of adults with disabilities. All of those are more vulnerable. And as Nova Scotians, the best thing we can do to protect them is to minimize the spread of COVID-19 in our communities, which then minimizes the chance of the virus being brought into one of these group living facilities. So the more we can keep COVID-19 at a low level and eventually eliminate it in our communities, the less chance there is of any infection moving into these higher risk environments. So even as we start to look at how we might slowly and carefully reopen society and reopen our economy, it's important to know that we'll all need to continue to maintain the social distancing, being in groups of 5 or less only where essential, things like good hand washing. Those are going to be very important for the long time, for weeks and months to come, and it's critically important that we all stick with those. And together we will manage this, and together we'll be able to get out of this with the minimum impact on those most vulnerable in our communities.